Good morning. Today I'm here with a very dear friend and colleague, Diane Murdock, who, among many things, has just inspired me so. Your background in health policy, your creativity as a visual and other type of artistry, your just kindness and empathy has been incredible to not just witness, but be in your life, Diane. And it was no surprise when I learned that you were interested in learning more about the whole area of death, dying, and in particular, what we're going to be talking about today are death doulas. Not only what they are and what they do, but what it is about, and this whole issue of death and dying, at least in America, as you and I have discussed before, is very textured. It's frightening to people, it's beautiful to other people, it's confusing. There's just so many layers to get into, and you've spent so much time studying, actually being at the bedside of many people. And I thought, within the context of what we're trying to do with Health Dame, being able to talk about topics that people don't always want to talk about, and yet when they have the opportunity to learn a little bit and not be afraid, it's very reassuring. And I can think of no one better to help us kind of walk through some of the highlights here is you. So I'm very honored that you have the time to talk with us today. So with that, I know you're going to weave in as we go a little bit about your background, but when we hear the words death doula, what should we know? Tell us what we need to know. Take it away, Diane.
Well, thank you for that introduction. It's a wee bit overwhelming for me, but thank you so much all the same. Um, a death doula, I want to back up because I
Sure.
feel like first we have to say, well, what is a doula? And I think it comes out of ancient Greece, and that was when they looked to non-medical people to be there for someone who's dealing with some sort of health care experience and to be there from the beginning to the end of that. And so let's talk about everybody's probably more familiar with birth doula. And
Right.
that is where somebody is there for the before the birth, during the birth, and after the birth. Whether there's complications or not, is just to be there and is a companion and is a guide through that whole process. And so then death doulas have come about. And this is end of life doulas is another term. It's helping you and your loved ones as you go through and when time grows short.
Ah.
And to me, there's a lot of terms that are around what death doula was. Because some people feel uncomfortable even with the word itself, death. You're a guide, you're a companion. Some people call it end of life manager. You're a listener, you're a coach. You can be
Is there special training for this? Like, how do you become this guide for people?
there is training, and you can become certified now.
Ah,
And we can talk about that. I just wanted to end on one thing as far as the doula goes,
oh,
because
sure.
I feel like I love somebody mentioned it's like being a seamstress. And
Oh,
you're threading together the person who's dying with their wishes and with their needs and with their loved ones. And so it's making this tapestry I look at for when you're approaching and letting go. And there's a subtlety that I wanted to mention, or maybe it's not a subtlety, but I think it's worthwhile mentioning that I feel that people say, "Oh, God, you have a relationship with dying and death," and I don't even know if that's as relevant as the fact that that you have a rapport with life,
Ah, I
That
love
the
that.
rapport with life is that because you're living till you die. And so I think the person who is there as a death doula is bringing your life together with you. That's how I would look at it.
And
Oh,
if somebody is interested in wanting to work or be present with a death doula, how is it the person that reaches out? Is it the family? How does that, what are the mechanics of how does that work?
Um,
I imagine it differs.
well, maybe we can talk about how did all the death doula come about? Because
Please, absolutely.
I think that it's a term more and more people are hearing. They go and they're not always familiar with it.
Right.
And And I don't think it was a term that was around even like 10 years ago as much as it is now. And so I feel that it's filling a niche that is very important right now. And that is because for lots of reasons that the medical field is changed phenomenally. The medical terrain of dying is as much reflective of medical advancements as anything else.
Sure.
Many treatments and many procedures and choices to be made. And so even though I look at medicine as still an art, I feel like it's going heavily based into technology and the sciences. I feel also what happened is why we have more death doulas or it's being talked about more is that there's this legalese that comes from this more complicated medical
Yeah.
terrain. And that is all these documents from HIPAA documents, which is freedom to give information to whomever you choose.
Right.
It is informed consent. It is patient rights. That was not there before. And then also for dying, you need to have an advance directive. Some people call it a living will. You're picking someone, a proxy, a healthcare proxy. This
It's gotten
person,
complicated.
it's very complicated. Person, you picking someone to speak for you when you cannot. And so what happens is then all these caring people are out there who are hospice, work with hospice, that are social workers, that are RNs, that these people are there and they go, I want to do more for in the field that I'm with to help people. And so they're gravitating, wanting to
I
fill that
see.
niche. And then I feel then the system is such, the healthcare system says, oh, we see there should be programs to train people to be present the way they should be and can be, to fit into this whole fabric of the healthcare system. Because you're mingling with all of the professionals. You're non-medical, but you're mingling with lots of clinicians. And so there you have it. That's why now I think people are getting certified, they're getting licensed, and then they're having to go out and solicit whether they contract with somebody. It's a contractual agreement, and then insurance companies may be coming in,
Oh,
covering.
wow. I didn't realize it was that far. That's interesting. Okay, okay. But so there's this rise in the number of and the awareness and the complication of dying. So therefore, there's always been a need for somebody to be sitting with someone as they move through the process of dying. Um, how much, speak a little bit about what you're seeing in terms of the taboo. It's been very hard. We talked before in passing about just death and dying. I find more people are open to talking about it. There is a growing literature. I think since the hospice movement has come to the United States, that opened up some conversations around death and dying. I mean, it's still hard to find people who get excited about talking about it, who, it's a very mixed emotions, but there's also, I mean, beauty isn't quite the right word, though there can be some beauty in coming to closure and certain reflections. And I think knowing you, I'm sure that's a big part of your practice, if you will, when you're with someone. Say, what is going on with is there still a taboo? What are you seeing? or is it changing?
Well, I it's let's back up. Let's go back to the 1400s because
Okay,
back then
okay.
it was called ars moriendi. It was in the Latin text.
What does that mean?
That means the art of dying. And
Ah, say the word again.
it
Say
is
it
from
again.
ars moriendi. It's a
Okay.
beautiful word, and somehow we've lost how to die well. This is what it was. And
Ah, I
I
love
think
that.
over time, if you reflect on the medical terrain of dying and its complexities at this point, that it lends itself to become, I don't want to talk about it. And I've had people who come up to me go, "Oh, I don't want to talk about it. It scares me to death." And I tell them, "Well, you don't need to worry about it. You're not going to die." But I I I think people should embrace talking about it. We only grow old once, we only age once, we only die once in this lifetime that we're aware of. And I think it's by talking about it, you're freeing yourself to know that your wishes are honored and given the dignity and respect you want when time goes short, and you're freeing the other people
So
not guess at what you want.
that, several years ago, and I think you did one as well, I was asked to conduct a conversation. It was something called Death Over Dinner. I think you've done it as well. And I met a dear friend, a physician, um, and we've stayed in touch. And in any event, it's such an interesting experience. In my case, I don't know how it was for you, but um, we were randomly put together. This was through a conference. It was an organized thing, different restaurants around DC. They specifically put random people together, and then one person had a list of questions to open up talking about death and dying in a very non-judgmental, whatever your belief system was, everything was honored. It was just a chance to talk about it without fear. And it was interesting because in my group we had several physicians, we had several, you talked about medical advances, and there were a lot of people who were in the innovation and technology space. And then we had people who were patients, advocates, not necessarily medical professionals. And it was one of the most fascinating discussions. And this friend, Dr. Hassan Teta, and I have become, as a result of that, are still friends and colleagues, very, really strong bonds. When you talk about these kinds of issues, you start to develop really special friendships because it is a pretty powerful topic. How do we get more people to start doing this, do you think?
I think you have to go looking. It's right
Yeah.
out there. I think that there's what you mentioned, the death over dinners, and it's just getting friends and family together and um, filling up a table, and that you're encouraging people to open up about what's important. And it's probably one of the most costly conversations America isn't having.
Ah,
And
interesting.
there's the Conversation Project. There's all sorts of sites. There's Engage with Grace. I printed this.
Yep. Yep.
I don't know if people can see it, but it's just 5 little simple questions
I
that
think that was Alex Drain, right? Alexandra
Alexander
Drain.
Drain,
Yeah,
she did a
she's
TED
just a
Talk.
wonderful friend. And I mean, what she's done was really to help break the ice in this area as well. And really important. I think she recommends doing it around Thanksgiving. So thank you for bringing this up because the time's right around the corner, and
It is.
that is a really good time. You have friends and family together during Thanksgiving. People fight over who gets to cut the turkey, if I'm remembering the movie correctly. But in any event, I know, what do you think it was that Diane drew you to this? Because you've been interested in it, you've studied it, literally taken classes, you've done writing, you wrote a book. What is it, do you think, that draws you to this very reflective space, if you will?
Well, I pondered that as well, and I
Yeah, I
continue
bet.
to ponder it. I think sometimes we just find ourselves doing something that we can't really explain why. but that we know it feels right. Um, I did get certified myself as a death doula. I think it was in 2022 from through the medical school at University of Vermont. But uh, but I feel like I only did that. I was already doing what doulas do for more than half my life. And it was just being present with the people I love that we are, that why wouldn't I want to be with somebody who is suffering and is in pain so that then we can hold each other and get through that and then share the joy. Um, it
And
is, how else could I not be there for this? Because it's so calming. You lend yourself to being contemplative and going quiet. So,
I will say that for some people, that's terrifying to do, and they don't want, so I think people hearing your experience is so important because it can, when you don't know something, you think it's one thing, but when you experience being with someone, it can be a completely different experience. And I know, I myself have been with people who have passed, all different ages, all different reasons, not a lot, but several times. And there is, I mean, other than the birth of a child, it's equally powerful and really quite, it for me, it felt like a privilege to be with somebody when they, because it is such an intimate moment. It is such a, just, it's hard to put it really into words, although you've done a really nice job. You've written about this. You have a book about this, right?
yeah, the book, well, I
Tell
took
us
it off
about
of
it.
Ars Moriendi. It was called The New Art of Dying, and it's how
Ah,
to personalize decisions to make it your own death, the way you would perceive it, to be true to yourself. It started as a catharsis. I lost my mother to cancer when I was in my early 30s, and she was not 65.
right.
And it started as a catharsis, but I think because I have a degree, an undergrad degree in medical sociology, the book became kind of a sociological
Ah,
explanation of the medical terrain of the dying. So it goes through all these things about medical decisions, legal decisions. What is a palliativist? How did they come about? What is a hospitalist? It was like, who are all helping people understand who are all these people that are they are caring for you, and why is it so overwhelming?
yeah,
And
yeah.
um, I will go back though. I feel when I'm with somebody, um, I'm not there to fix anything, and I'm certainly not there to talk. It is more about going quiet and letting the person lead.
And I think that you must have been reading my mind because not everybody can speak towards the end of life, literally. And there's something very powerful of being together with someone and a way of communicating without words necessarily. Is that right? I mean, that's been my experience. I assume that's not uncommon.
No, that's
Um,
the perfect way to say it. I think that a lot happens without any words. And I know people get really awkward with that. I, when you're a doula, you're not wearing that hat. You're going
right.
in there. It's not about you. You left yourself out of the room. And
Ah,
you're there just with an open heart. You're there to listen, letting the person speak. There is this wonderful term, a Buddhist concept that is part embedded into the death doula training is called turning toward. And you're turning toward another person's experience. And so you are there in this vulnerable space and being reflective with them and reflecting on the nature of suffering. And then by going through that, you've kind of pushed aside all this chaos and complexity, and you're able to then embrace what joys there were in the life you lived. So,
absolutely. And I do think I've seen it myself. People who are dying just absolutely know you're there. And knowing that someone is there, you don't have to say a single word, you don't have to make a single sound. You could play music, you don't have, whatever it is, you just sense it. And I know one of the other beautiful ways that when you would visit with Brian before he passed was you were so generous in bringing beautiful Belle, your dog, and having the dog with people brought a joy and a comfort. And again, no need to say a word, just having that beautiful dog. I mean, there's so many ways to help someone as they're passing, make it better for them, just calm. And it's a wonderful thing to witness. So let me ask you, what have we not talked about that you want to make sure people hearing of us having this conversation understand or walk away knowing about doulas and the role they play, and just a couple of things they should be thinking about or would be helpful for them to consider when it comes to death and dying and a peaceful passing, let's call it.
I think just that one should start having a dialogue about dying sooner than later, because I
Ah,
think with the dialogue and expressing your wishes, that the documents that you should have are really important to you because they're embracing and expressing what your wishes are, and that those documents shouldn't be stagnant, that they're organic, that they
mm.
change when you change. I think that's really, really important. Um,
So in other words, don't do them once, put it away and say I'm done.
right. I
As
think
you
too many
continue, yeah, you have to
people
keep
think they go in the
visiting.
safety deposit box. You can put your will in there,
Right.
but not your living will, not your advance directive. You need to have people know what you want when you cannot speak for yourself. And that it's something, it's an ongoing dialogue. That's all I can emphasize to you. Another thing that's kind of, I mean, there's a lot of humor in being a death doula too.
Ah,
I think I wanted to bring that up because um, you know, you're talking about their life and being able to see the charm of your life and the highlights and the laughter of it. And because you're letting go of so much. So
yep.
sometimes I'll sit with people and they'll tell stories and I help them write that story so that that's then shared with their loved ones.
As terms of an
Um,
obituary, you mean like
Right, well,
writing
that's
and
a story, but obits, yes, I helped. That's a great thing because I helped my cousin write his obit.
oh my God,
Um, and it was one of the things we learned as a doula. You had to write your own obit. I ended up loving mine
fascinating.
because it's not about that you went to this high school and you were this head of this or that, the other. It's about expressing what you want expressed about who you are and who you've been your whole life. And so I thought I'd read one little excerpt
Please, yes, yes.
Jim because I loved it. So I said, so talking with Jim was like sitting in a rowboat with no oars, out in the middle of a quiet pond, bobbing up and down, floating aimlessly. He was not one to be told what to do and not one to be rushed. Some would call him contentious, a curmudgeon, simply said he was someone who enjoyed his solitude, a bibliophile, especially of spy novels, of which he collected the equivalent of several library
Oh my
stacks.
God.
And this is the end, a rare character, a real hoot, sweet, generous to his core. He is imprinted in our hearts. He will be missed.
Oh, that's
And so
beautiful.
that's the kind of thing. And so it again, it just helps a person reflect about, well, who have I been? Who have I touched? How have I been present in this life? And so there, it ends up being uh, I guess this special treasure time. I think that when you go into sitting at somebody's bedside, you're looking to get nothing out of it, but then you're getting everything out of it.
Oh,
So
yeah.
that's how else I don't know how else to express.
Wow. So I do think I'm going to write my own obituary this weekend. I actually love that idea. I really do. I think it gives you a chance to think about who you are and who you, if you still have time, who you still would like to become, if, or stay the course, you know, but it gives you that chance to really think about literally your legacy. And what better way to try to write your own, that
And
I
no one's exhausted from having to figure out what to say about you. You've got to say
yeah.
about it yourself, which is wonderful. Another thing that is, I feel like, is invaluable is music. I think music should be resonating in your heart and in your soul and in your ears. That it's not irritating at all. I think that you should always be surrounded by music, and it's even still, most especially as you're there towards the end. And I can only give examples. I was with my uncle Bruce, and he was loved opera. And Saturday, the Metropolitan Opera
Yep.
was broadcasting. It turned out to be Romeo and Juliet. So that's what we listened to that afternoon. He passed away that night. How could I not treasure that?
Right.
With my another cousin Laura, I was with her. She was always going to concerts where concertos of Mozart were played. So that's what we listened to ad nauseum. It never gets tiring. Um, and then a very special memory is that my dad loved big band music, Glenn Miller.
Oh,
And so at the towards the end, or at the end, the Lennon sisters were playing Bugle Boy Blues.
yeah, yeah,
And
yeah.
that's when he passed away, which was
Perfect.
really special because he was this decorated World War II hero. And I feel like he said, "This is it. It's time. I'm coming." Anyway, yes, music is invaluable.
It
So,
really is. And actually, hearing from what I've read is the last sense to go, and people can hear
oh,
literally up
absolutely.
till the end. So, and of course, music and the brain is a big theme through a lot of the work that I do. And there's no question that music is incredibly powerful and meaningful, both for the person who's sitting with someone and for the person who's passing. And I guess that's our perfect segue to my last question for you, which is the one I ask everyone I speak with is, I'm putting together the Health Dame playlist. So what piece of music can I say in honor of you, we will add to the list?
Um,
What is your song, my dear?
well, to tie back into being open and thinking about not just your death, but dying and what kind of ceremony rituals my husband and I put together for our own list for what we call tunes to die for. And his is all rock and roll. Um,
Okay. I would
and
expect nothing less. Yeah.
and mine is more eclectic. And so I looked at my list to come up because I knew you'd ask me this question. So I think the Penguin Cafe Orchestra,
Uh-huh.
and it's called um, Perpetual Motion, I think it is. And there's also something rubber band. Hold on, I wrote it down because the titles are something else. It's Perpetuum Motion Mobile and Telephone and Rubber Band.
Oh,
Telephone and Rubber
wow.
Band.
All right, let
One
me
or the
write that
other.
one down.
And
Telephone and rubber band. Okay.
and
The
then the other
same
one is
group.
Perpetuum Mobile,
Got that
the
one.
Penguin Cafe Orchestra. And so both of these orchestrated pieces take you on this splendid journey. That's why I love them. And I'm
Um,
leaving it up to Health Dames and you yourself to choose which one. And then you can
well,
tell.
there's no rule that says we can't do both, so you get the twofer. So there you go. I can't thank you enough, Diane. Thank you so much for sharing your wisdom and really important information. And I think I already have ideas for follow-up conversations with us and other people who are looking to break down some of the barriers to these really can be difficult and trying questions. It's emotional, there's no doubt about it, but like you say, better to start now with a clear mind and an open heart and a little bit less emotion and really think about what you would like for you as you go on to your next chapter, so to say. So with that, I hope you have a great day, and I really appreciate your time and sharing all of this with us. So thank you, and thanks for all that you do in this space. Take
Thank you
care now.
very much.
Bye.
Appreciate it.